I find being here a little uncomfortable and scary.
See if I can take you through that and maybe make it a little less scary.
Can I try it?
Yeah.
There is a lot that goes on when you get a cavity filled, so we are going to talk to an expert about what this is all about. We are here now to demystify the whole thing for me and everybody else.
Okay.
If you could explain what happens when
Sure.
somebody needs a cavity filled.
First thing we do is give topical, which
Very
is
familiar
basically
with
a numbing jelly, right? So we leave this on the gums for a couple of minutes till you feel it start to tingle a little bit. Then we give the injection. And believe it or not, it really doesn't have to hurt. This is the needle. When you have good topical, you really don't feel the needle going in. Just give a couple of drops, let that kind of sit. It does numb the area sufficiently so that when you give the rest of it, it doesn't hurt.
Can I try it?
Sure. Okay.
Okay. Oh, sorry.
So that would probably hurt if you did that. So once you're feeling good and numb, then we get started on the fillings. You probably know we use a drill. This is the handpiece, and it sprays water like a water gun, cleans out.
I was
that
not
too?
expecting that.
Yeah.
Okay. So it's a tiny little actual drill that's spinning. The idea is to scrape out all of the
Basically,
decay.
yes. Now that we finished cleaning out the cavity, we have a new set of instruments here and tools that we're going to use to fill the cavity. So we have, this is called etch. It's basically an acid, it's phosphoric acid, that's used to clean the surface of the tooth, and basically it opens up the tubules in the tooth to allow the bonding agent and the adhesion process of the filling. So
this is not, it's
this
not
is
a
not
needle.
an injection.
Okay.
This is not an injection, and a lot of people see it and they think they're getting another injection. It is just a surface cleaner.
Oh.
And that stays on the tooth for about 15 to 30 seconds, and then we wash it off with water. Once that is washed off, then there are a series of other materials we apply to the tooth. I usually use a desensitizer to make sure that there's no post-operative sensitivity. Sort of an optional step, but that's what I like to do. And then we use these micro brushes, dip it in, scrub it on the tooth. So that gets air dried, and then this is bonding agent. And it's also a clear liquid, kind of looks like clear nail polish. And then we take a fresh brush, and that goes into there, and that gets painted onto the tooth surface, and then that is cured with a light. So it's basically, it coats the surface of the cavity. So this kind of infiltrates those tubules and creates like a bridge for the filling material into the tooth. And then we put in the filling. So this is the filling. It's called composite. And again, this is a light curable material, so it comes out of this gun. And then we use, these are the instruments we use to shape it. So it's shaped. You see how it's kind of like moldable?
You're sculpting.
We'll do this in multiple layers, and after we shape the layer, then we hit it with the light again. So after the filling is placed, we would check your bite, make sure that your teeth are hitting the way they normally do, and then we would polish it. So we would change out the burr on the handpiece and put in a polishing burr and make sure everything's nice and smooth, and if there's any excess that might need to be removed. And that's pretty much it.
So this was really helpful. This is not as scary as it seems when you don't know what's going on. It's a lot like getting your nails done, and the person who's in charge knows the steps and knows what to do, and it all makes sense. Yeah, this was really helpful. Thank you.
Good.